Now, mask wearing on public transport, it may return. Of course, we've seen Germany say, well, we're probably going to have masks back from May until October. No, yeah, they've decided to bring back masks.
Yeah, and like what's interesting here in Ireland is how quickly we went away from the masks. You know, the moment it wasn't mandatory anymore in some settings, people just really, it was almost like, you know, embracing freedom kind of thing. And you see it in other jurisdictions.
Yeah, exactly.
It's like 2 weeks and the next thing I just completely forgot about it.
Yeah, it's incredible, really. So you see now, like, because obviously COVID, it's in the nature of the virus to kind of ebb and flow and rebound. So it is on the way back at the moment. You see that reflected in the numbers in hospital, up to about 550 or 560. That's from 180 at the end of May. So we're clearly in the middle of a kind of summer wave. Now the question is it going to be like those first kind of ruinous waves, or is it much more likely going to be like the Omicron wave? Nonetheless, people will be saying, is there anything we can do to arrest this? And the first port of call is those kind of less invasive, less restrictive measures like mask wearing. So you saw Stephen Donnelly kind of floating this last week on a podcast with RT. They got some coverage yesterday, and now you see Paul Reid. Now the funny thing is, Paul Reid can come out and say he thinks it's a good idea, but I think in terms of like mask policy or COVID policy, he doesn't hold any kind of formal advisory function to the government, and the body that held that formal advisory function, NEFIT, is gone. The body that replaced it hasn't even met, and Tony Holan's off and out of position in about 2 weeks.
I was really interested to see the INMO General Secretary Phil Hay. She said that actually, I mean, the hospitals are looking pretty bleak at the minute. She said that the hospitals are completely overcrowded to a level that we don't normally see in the winter, but it's June.
Yeah. And I think that
the COVID numbers are high, like
they absolutely are. And of course, we shouldn't forget that, you know, for every COVID person in hospital, whether they're there for COVID or with COVID, you still have the same isolation measures that attach. So, like, I was talking to someone last week about this, and they said that, you know, the nature of the COVID challenge has changed from like this kind of fundamental, you know, apocalyptic thing to like something that compounds and complicates the provision of healthcare in Ireland. And what you get now, like the net result of COVID now, is something like a trolley crisis every 3 to 4 months as opposed to once a year.
Yeah,
that's scary, isn't it? Overcrowded in June.
So what do you think? You're going to start wearing the masks again? 0896 111 111 to get in contact with that. And it's just
masks on buses and trains.
But anecdotally, you're not on a bus or a train. What are you talking about? You're in your car.
If I was.
Bus or a train.
In his driver.
Exactly. Put that mask on there.
But it's just kind of to see it come back like that. And anecdotally, like, you know, mates, it's like, oh, I can't go, I've got COVID. Like, a lot of that is happening again.
Yeah,
it really is.
Everywhere, yeah.